Okay, well, hello everyone. Thank you for joining us today. I would like to welcome you to our series, Ensuring Equitable Access to Oral Health Care for Individuals with Intellectual and Developmental Disabilities. I am Dr. Matt Horn, and I am the Dental Director at the Massachusetts Department of Public Health, and I will be our moderator for our session today. Let's get started with a few quick housekeeping items. Everyone has been muted upon entry to minimize background noise. If you have a question, please use the chat function at the bottom of your screen, and we will moderate questions in the last 15 minutes or so, time permitting. These presentations are being recorded and will be shared and posted on mass.gov. An evaluation will be emailed out shortly after the end of the presentation, and you must complete that evaluation in order to receive CE credit. These sessions are meant to be an introduction to providing oral health care to individuals with intellectual and developmental disabilities. The focus of this virtual series aligns with our vision at the Office of Oral Health to eliminate oral health inequities in the Commonwealth. Educational programming like this works to increase the strength of our oral care network by providing knowledge and best practices to improve access to care. In the first Massachusetts-wide health needs assessment of people with disabilities, adequate dental care was identified by respondents as the #2 big problem, only behind affordable housing. We must make sure all people have the support they need to access oral health care. Let's use this series as a kickoff in the conversations to look at how we can make oral health care the most inclusive and accessible for all patients. Let our work lead to a future collaboration around research, education, policy, and innovation. Okay, now I'll invite you to join me as we welcome our first presenter and apply our oral health equity lens to our presentations today and throughout the series. A reminder that this is session 1 of 4. Today's session will explore oral health needs as well as diving deeper into considerations for billing dental insurance with a highlight on the MassHealth Medicaid dental program. I'd like to introduce Dr. Catherine Hayes, MassHealth Dental Director, to open up the session with some additional welcoming remarks and framing why we are here today. Dr. Hayes received her DMD from Tufts University. She completed a general practice residency at Brigham and Women's Hospital in Boston and received both master's and doctoral degrees in epidemiology from Harvard University, where she also completed a dental public health residency. Dr. Hayes is a diplomat of the American Board of Dental Public Health and is a past president at the same board. She is actively involved in research and policy initiatives related to oral health disparities and inequities throughout her career. She has numerous published articles and book chapters in the field of dental public health and epidemiology. Currently, Dr. Hayes is the dental director of MassHealth, the Massachusetts Medicaid program. She is also a clinical professor at the Henry M. Goldman School of Dental Medicine at Boston University and a lecturer at Harvard School of Dental Medicine. Whew. And finally, she is the Director of Dental Services in the Division of Commonwealth Medicine at the University of Massachusetts Medical School. And I'll add to that I also consider Dr. Hayes a critical oral health program partner and a personal mentor. So thank you, Dr. Hayes, for presenting today, and I'll turn it over to you.
Thank you, Dr. Horan. I'd like to thank you and Brittany Brown from the DPH Office of Oral Health for sponsoring this important series, and also to thank the Massachusetts Dental Society for their collaboration. So I'd like to first provide an overview of what we know from the literature. So first, what is intellectual disability? And this is from the American Association of Intellectual and Developmental Disabilities. Intellectual disability is a disability characterized by significant limitations in both intellectual functioning and in adaptive behavior, which covers many everyday social and practical skills. And this disability originates before the age of 22. We have many studies that have been published on the oral health status, which is very important, and we need this information. My hope is that what will come from this series of webinars is really a move towards working to find ways to really address these inequities and to minimize these inequities. So in the various reports, which I'll highlight several of them for you today, what we know is that there's a greater degree of tooth loss, periodontal disease, and untreated dental caries in this population. And this is important because we know that the loss of functional dentition has serious consequences, most notably problems certainly with chewing, swallowing, nutrition, speech, TMJ, osteoarthritis, pain, and relationships to systemic diseases. We know that oral diseases are preventable, and the challenge is really to find the best way to prevent these diseases so that these individuals are not suffering from these oral health sequelae. So one of the first studies I want to highlight was actually done here in Massachusetts with the Tufts Dental Facilities Program. And for those of you who are not familiar with the Tufts Dental Facilities Program, this is a statewide program with various clinics across the state focusing their dental care on individuals, mainly adults with intellectual disabilities. This particular study was a retrospective study of their clinical and demographic data from their electronic health records. So it's important to note then that these are individuals who were able to access dental care. So these results, these findings may actually be an underestimate of what the true nature of the oral health conditions are of this population. This study included 4,732 adults with intellectual disabilities receiving their dental care through the state-supported Tufts Dental Facilities Program. The mean age, the average age was 47.5 years. And overall, 87% of the dentate population reported experience with dental disease. Now, that's not unusual and actually compares to the general population. But what we note in this study and in other studies is that although the overall caries experience might be the same, we see differences in terms of missing teeth and decayed teeth. And I'll go over that as we discuss those results. So some of the factors noted in this particular article by Morgan et al. In the Journal of American Dental Association is that the following factors contribute to the risk of oral disease: the cognitive, physical, and behavioral limitations that this population experiences limits their ability to perform daily oral care. And it also interferes with their ability to cooperate during dental visits. And many of the medications also that they're taking affect oral health, most notably by causing xerostomia, dry mouth, decreasing the salivary flow. And as we all know, saliva is an important protector for decreasing the risk of dental caries. We also know that in this population, there are elevated rates of poverty. And as Dr. Horan pointed out at the beginning, the number one issue facing this population is the need for affordable housing. And the number two issue is the need for adequate dental care. So it's really important that we address this really important need for this population. In the Morgan study, what they point out is that there are several factors that should be considered when identifying preventive strategies for individuals with these types of disabilities. Certainly age, their ability to cooperate with dental treatment, type of residence. Some live at home, some live at group homes. And I added here caregiver involvement. It's really important that we work with caregivers because it really is the daily oral care that's very important in terms of preventing disease, and also work with caregivers in terms of identifying a time schedule for individuals to come in for their regular checkups so that we can prevent more extensive disease. And this, the data from the study from Morgan et al. From the Tufts Dental Facilities, I put a comparison here from their paper with national data. So we can see that untreated decay in the population in these clinics was 32%, whereas national data from the CDC, it's 22.7%. So that's quite an increase in untreated decay. Periodontitis, this population really suffers from periodontitis. We can see that 80% of the individuals in the Morgan study had periodontal disease compared to only 47% of national data. And the edentulosum rate, so the tooth loss, these are people who have no teeth. So almost 11% in the Morgan study compared to 7.6% in the national data. So if we look, as I mentioned, if we look at the DMFT, which is a measure of caries experience, we may see comparable rates. However, if we look at the components of that, so if we look at D as decayed teeth, we have a slightly increased number of decayed teeth amongst this population. Missing teeth, and this is consistent across the studies that I'll discuss today, the missing component, teeth that are missing due to caries. So what's happening is a lot of these teeth aren't necessarily being restored and they are extracted. And the filled teeth is slightly higher in this population. So I want to just go over just a couple more studies. This is a systematic review. And for those of you who don't know what a systematic review is, this is where you take data from a large series of studies that are looking at the same thing and combine them together. So this particular systematic review was from 2010 and included data from 12 countries. And what they found is that the oral hygiene was poorer than the general population. And just like in the Morgan study, higher prevalence and greatest severity of periodontal disease. And that's important because this can also contribute to tooth loss. The caries experience, like I mentioned, so the DMFT is comparable, but there are more missing and fewer filled teeth. And the level of untreated caries is greater than in the general population, similar to what we saw in the Morgan study. And the conclusions from this particular study were that we need to develop strategies to increase patient acceptance of routine periodontal and restorative dental care. We want to decrease the periodontal disease, and we also want to increase the treatment of dental caries instead of extracting the teeth. And we also need to develop strategies that ensure that dentists and hygienists are prepared to provide this care. And we also need to develop effective preventive strategies. A systematic review published just a couple of years ago in 2019, which included over 14,000 adults across 33 studies, again found poor oral hygiene, gingival inflammation, periodontal disease, untreated dental decay. And again, the missing component of the DMFT was high in most studies. So again, meaning there's untreated disease, there's active disease, and people are losing their teeth because of oral disease. Oops, what happened? Sorry about that. So continue on with this systematic review. Although there was inconsistency in individual studies about oral hygiene, overall, there were much higher rates of plaque, poor oral hygiene in this population. And the majority of studies also found worse gingival health and periodontal disease. And there were some studies that had that looked at children. So nearly half of the relevant comparisons revealed that children with intellectual disabilities had fewer filled permanent teeth. So again, there was untreated decay, and again, more missing teeth. So the conclusion the authors state from this particular study is, despite reports in the past of poor oral health amongst individuals with intellectual disabilities, and despite it being preventable, there remains a high burden of poor oral health. This highlights the need to raise awareness and for policies on effective daily oral care and appropriate service provision. The importance of oral health and its possible negative sequelae needs to be elevated amongst caregivers and professionals. I would say this slide really sums up nicely why we're here today and why we're doing this series. We know we have data. We know oral health is poor amongst this population. Now we have to really make sure we are addressing that and closing this inequity gap. So there was a systematic review looking at children and adolescents, and consistent with the adult studies, there were higher levels of dental plaque, worse gingival health, even in children and adolescents, fewer decayed and filled permanent teeth, more missing teeth, even in children and adolescents. And the caries experience between males and females was similar, so there was no gender difference there. What I'd like to spend a couple moments on is going over a survey that was recently conducted amongst MassHealth dental providers, addressing the issue of treatment of individuals with special needs. So the majority of individuals said they do treat people with special needs, but I have to point out we didn't have a very high response rate. So this is probably skewed towards those who actually do provide care for individuals with special needs. The majority were practicing dentists for longer than 10 years. And again, the majority were treating individuals with special needs for longer than 10 years. And when we look at the number of special needs Mass Health members per month, the majority saw 1 to 10 members, and there was a lower number that saw higher numbers, and a small number that saw greater than 40. Most of those providers that see greater than 40 are in the Tufts Dental Facilities program that I mentioned a moment ago. So we wanted to look at the number that they see under age 21 and also over age 21. And we don't see a great difference here to the overall. It seems that's really skewed to 1 to 10 per month, and we'd like to see these numbers increase. The number here with greater than 40, again, I think this is skewed by the Tufts Dental Facilities program. They are the largest provider of dental care to this population in the state, and they see the vast majority of patients. When we asked about preparedness to provide care, as you can recall from the previous study, this is one of the most important things we need to be focusing on. We need to make sure that we're training our students and also our currently practicing providers to feel comfortable in providing this care. And the majority feel somewhat prepared, which is less than feeling prepared. So there's a real tentativeness there. And very few feel well prepared or very well prepared. So there's a need here for education, continuing education. And throughout this panel of webinars, what you're going to hear from providers, including an individual from the Tufts Dental Facilities program, what their best practices are. And our hope is that we will continue to provide continuing education for practicing providers so that people will begin to feel more comfortable and more prepared than they currently are. We wanted to get a sense of what percentage of individuals are being treated in the operating room. And we see that the majority do not necessarily need to provide this care in the operating room, although certainly there are some that do. And we wanted to know, what are some of the barriers that dentists perceive? And I should point out, this was just dentists. I think it would be great if we did one with hygienists and also dental students and dental hygiene students. So extended treatment time was a barrier that was noted by the majority of participants. Also, the difficulty in performing high quality dentistry and lack of training and loss of revenue was lower on the list of barriers. When we asked whether or not they were interested in pursuing training, the vast majority said no, but I think that that could be because people might interpret that as something like an extensive GPR or something like that. I think it behooves us to really find ways to provide this training in a meaningful way to providers, and one that is convenient so that we will see greater participation and hopefully balance out these numbers. So in summary, from all the studies that are available, we know that the population with intellectual disabilities have greater oral health needs than the general population, and resources are needed for caregivers and patients, and training is also needed for dental and dental hygiene students and practicing providers to increase the dental workforce that can provide compassionate and comprehensive care to individuals with special needs. And there are many resources available. This is just one that I'm highlighting here from the US Department of Health and Human Services. There are various brochures that are available to caregivers and individuals to help them with providing adequate oral care. Again, it's the daily care, the daily preventive regimen that's really important, in addition to the care that they would receive from a professional dental provider. So with that, I'm going to turn it over to Tracy Chase to talk about some of the logistics, and then we'll open it up for questions, as Dr. Horan said. Thank you, everyone.
Thank you, Dr. Hayes. As Tracy's sharing her screen here, I'll also remind everyone that we'll be taking questions at the end of both presentations. And now I'd like to go ahead and introduce Tracy Chase Gilman to talk about the MassHealth Dental Program and the Behavior Management Code. Tracy Gilman has served as a regional director at DentaQuest, responsible for the MassHealth and Health Safety Net contract, serving over 2.3 million members and over 2,400 dental providers in Massachusetts for the past 10 years. In this role, Ms. Gilman is directly responsible for MassHealth provider relations, outreach and intervention, complaints, grievances and appeals teams, and the Board of Hearings relationship. Ms. Gilman is also responsible for collaborating with partners across the organization to ensure regulatory and contractual compliance and innovation related to both programs. Ms. Gilman has held a certification in dental assisting through Danby since 1997, and in addition, she holds a master's degree in management. And I'll also add that I've worked closely with Tracy and her team at DentaQuest as a Medicaid participating dentist. And take it away, Tracy.
Thank you, Dr. Han. I appreciate it. Let's dive in. Oh, before I dive in, I want to mention there's two team members that most of you probably already know that are on the line with me. Megan Mackin, she's an outreach coordinator for MassHealth who's been with the program for many years, and Keisha Lopez Christian, who's part of the provider relations team. They'll be helping address questions. Let's dive in. So as Dr. Hayes had said, we have, MassHealth has DDS coverage for both children and adults who are determined by the Department of Developmental Services to be DDS clients. Is there a difference in coverage? Well, the adult DDS members do have an enhanced dental benefits package. It was more enhanced before the adult restoration took place, and now many of those codes are covered under the adult regular subgroup as well, but they do have the ability to apply for prior authorizations for additional cleanings and fluoride applications, and that's something that the adult regular population does not have. So it is slightly enhanced. I want to just mention before I dive into everything too, that the office reference manual is the guide to the program in addition to the regulations. So I want to make sure that I point out that the office reference manual is located on both the provider web portal if you're participating, but it's also located on the website, and I've included the website here. If you look in the office reference manual and exhibit C and F, you'll find the list of codes and the coverages for DDS members, and that's in the back of the office reference manual. And I just want to put a plug in for those participating with the program that if you'd like to learn more about the office reference manual and how to navigate it, you can actually find a training on the office reference manual on the website, on the dentist tab under the document section to learn more about how to find what you need in order to be able to work with the program. So I just want to put a plug in for this. Code D 1354, interim carries arresting medicament application, became covered under the program, June 22nd, 2020. It is covered under MassHealth, the Children's Medical Security Plan, and the Health Safety Net programs for both adults and children. The limitation is twice per tooth per lifetime, and the fee is $15. And I just wanted to make a note here that participating public health dental hygienists are also eligible to bill for this code. Two things that are really important to know about silver diamine fluoride. So silver diamine fluoride is covered under code 1354. It's included under that coverage for that code. And I wanted you to know that we do have great recorded webinars that actually were hosted by Dr. Hayes and one of our outreach coordinators, Flora Pietrasanta, located on the website. Again, dentist tab in the documents section that you can watch, which will provide a lot of information about the importance of silver diamine fluoride and its uses. We also have this collateral piece that's located on the website, again, in the documents section under the dentist tab, that can be used to have that conversation with patients about the importance of silver diamine fluoride and just important things they need to know. So it's not only for you to help maybe have that conversation, but it's also a takeaway that the patient can have so that if they forget some of the conversation you had about what to expect with silver diamine fluoride, they have this, they can refer back to it. So Matt asked me to include this slide, and I think it's an important conversation point. We get a lot of questions about whether or not you can bill for a different code for a current covered service from MassHealth. One of the main focuses folks have had lately is on the Crown Code for adults, the 2751, that was recently restored with the adult restoration. So I wanted to walk through how you can provide an upgrade to covered services, so that you would understand how that works. So in the office reference manual on page 13, you can find this language. It's also within the program regulations, and I've cited where that is located, where providers may upgrade medically necessary services at no additional cost to the program and no additional cost to the member. What that means is if you take, like, say, this Crown Code as an example, is that if you want to provide a Crown service, but you do not want to provide the service that is covered under the 2751, instead you would like to provide an upgraded service for that Crown service, you can do that as long as you're willing to bill for the $27.51, accept that fee, and you would need to note in the documents section of the claim form or the notes section on the web portal what service you did provide, that it was an upgrade and a substitution, and just cite the regulations so that you have that documented on the claim form. This is not a requirement of the program, but this is something that you can do as a provider. And if you have further questions about this, please reach out to the team because we've been answering and fielding a lot of questions about this. I also wanted to just walk us through some new codes that were recently implemented in April. 2950, the core buildup, including any PINs when required, is now a covered service backdated to January 1st of 2021. And again, as I walk through these, I'm just going to spotlight them, but all of this information is located in the Office Reference Manual and the exhibits in the back of the Office Reference Manual. So all this information is available to you. So I'm just going to spotlight the codes that are now covered. Code 1575, which is the distal shoe space maintainer for children only. The D4346, which is commonly called the difficult prophy, is now a covered service for adults and children. And again, it's backdated to be effective January 1st of 2021. And then we have the vaccination codes that are actually became effective on April 1st of 2021. And those are for all ages. So now I want to dive into a little bit more about behavior management. So behavior management is covered under code D9920. It's covered at one day per provider or location. It is a prior authorized service. You must have prior approval for this service to be paid. It is covered for all MassHealth members except MassHealth Limited members. And it is covered for HSN members with prior approval as well. I wanted to mention that you must include a description of the member's disability and types of services to be furnished. We'll talk a little bit more about that in a minute. But I also wanted to spotlight that the fee for this code was increased from $43 to $86 on October 1st of 2018. I have a little bit of data here to show before we talk about how to submit that prior authorization. And I just want to spotlight the DDS members here. So in 2018, we actually saw 219 PAs submitted with a 40.64% approval rating. The adult DDS, we saw 1,036 PAs submitted with a 73.46% approval rate. And again, before I actually move forward, I want to spotlight that fee increase from $43 to $86 occurred on October 1st of 2018. So you'll see with the data here that we actually had a 526 PAs submitted for child DDS members, which was an increase of 307 prior authorizations. And for the adult DDS populations, we had 850 submitted, which is a decrease of 186 prior authorizations. However, for both populations, we saw increases in terms of approval. For the child DDS, we saw an increase of 7.27%. And for the adult DDS, we saw an increase of 14.42%. We believe that the increase in the number submitted for child DDS members is due to the rate increase. The decrease in the adults, we're not sure, but I do know that we've been working very hard to try to educate providers about the importance of using this code, the fee increase, and just really walking through how to submit those PAs and what's important in that narrative to be sure that we can increase those approval ratings. Because I understand that does contribute to whether or not providers are providing the service and billing for that. So one really main core point here that I want to drive home, because 99% of the time when providers come to me and they ask questions, or the team, and they ask questions about why they're getting denials on prior authorizations for behavior management, it's because they're not submitting a member-specific narrative. So it's important. Often providers put in language into their software systems that's just auto-generated on claims for this code and prior authorizations to be submitted. It doesn't work. It has to be a member-specific narrative, and you really have to make the effort to describe the mental, physical, or developmental disability. You have to describe previous attempts at treatment, including extra staffing, type of behavior management technique utilized. It's really important you provide as much information as possible. We see that folks that originally have issues with approvals, once they do this, they start to see a greater percentage of approvals. So if you have any questions about prior auths that you've been submitting for this code and you've had a lot of denials, Don't hesitate to reach out to us. We'd love to look at what you're submitting and help you understand what might strengthen that. What details might be included to make sure that we're looking at all of the information that we need to when the dental consultants review for approval. Just a reminder, all MassHealth Medicaid members are eligible for transportation, but they have to walk through the process to be approved. So they may be eligible for transportation coverage. So what you can do as a provider is you can assist them by submitting the request. It must be submitted by the provider. It cannot be submitted by the member. It is a form called the Prescription for Transportation, the PT1 form. And there's a website you can go to submit this right online. And there's a number you can call to get assistance with actually filling it out if you have any questions. And I've included that information here. But to save you from taking down all this information, there is a brochure on the website on the dentist tab under the documents section that walks you through all of this information so that you can go ahead and submit those requests for members when needed. And then for those of you that are not a MassHealth provider, I just wanted to take a moment to invite you to reach out to us and become a MassHealth provider or have a conversation with us about becoming a MassHealth provider. We do have currently over 2,400 of your colleagues in network, and we're grateful for that. They're providing amazing care for MassHealth members. You do have the ability to cap the number of members that you'd like to see. There's no limit. So you can have that conversation with us and decide if you want to be on the directory, if you don't want to be on the directory, and who you'd like to, how many you'd like to be seeing so that you can limit those within your practice. We have a strong intervention services team from the provider side as well as the member side to assist you with members if they're missing appointments, helping provide education and assistance to members. And we also have a dedicated provider relations team who is working tirelessly to support offices and make sure you have what you need to decrease administrative burden. We also have a dedicated website and web portal for providers so that you can look at all of these resources I've talked about today and then some, as well as recorded trainings and provide a wealth of information that you need to make working with the program a little easier. And then we have a whole bunch of resources for those providers that are participating. And these are also included in the office reference manual in the front section. And we have these, I think, in just about every presentation we do, but we have the link to the provider web portal as well as the website. The regulation updates are really important so that you know when public hearings might be taking place. Member enrollment, in case that's necessary for you to provide to a member so that they can call and ask questions about their enrollment status. Also, the MassHealth Dental Customer Service at DentaQuest. We are open 8 to 6, Monday through Friday, and then the IVR is available 7 days a week, 24 hours. And then we have a lot of other important resources like the newsletters and webinars and town hall recordings, as well as upcoming events and more located in both the website and the web portal. And lastly, we have an email list. This is newly developed this year, and we're trying to make sure we have everyone on it because we want you to hear about all the exciting things going on within the program and any changes. So if you have not been receiving emails from the team and you are participating, please reach out to us and get us your email address so we can add you to that email list. And then, again, this is in the office reference menu in the front section, but this is how you reach us. Don't ever hesitate to reach out to myself. Keisha, she's responsible for Boston and the southern part of Massachusetts. And then Dan Archambault is responsible for Central and Western Mass. Reach out to us anytime with any questions or if we could be of any support. All right, we have some questions.
Thank you, Tracy. And again, thank you to Dr. Hayes. We will switch gears here and use our remaining time for questions from the group. They're quiet in chat, I think.
Oh, here we go.
Yes, what type of dental clinics participated in the survey? I guess this is one for Dr. Hayes.
Tracy, are you familiar? I know we had 2 survey versions. One went out to providers who indicated that they treat individuals with special needs, and the other went out to the general population of providers. So it's really a cross section of the provider network.
That's correct.
We had another question related to, do other state Medicaid programs have a similar program to the MassHealth DDS one? And do you know if those cover the behavior management code or an equivalent?
Tracy, I don't know if you want to jump in. I am not aware of another program that has that collaboration between DDS, the Department of Developmental Services, and MassHealth and the Department of Public Health. But that doesn't mean they don't exist. I'm just not aware of any.
Yeah, and what I would say is, as far as coverage goes, I'd reach out to your Medicaid program, or if you're already participating with the Medicaid program, I'm sure you have resources like the Office Reference Manual or a contact number where you can reach out and ask about the coverage for behavior management, because it does vary state to state.
We had a question about how are individuals identified to be DDS members? Is it by their diagnosis coding? I believe that's what that is. Or is it indicated on their enrollment file in some way? What about those individuals with mental impairment?
So DentaQuest is not responsible and does not manage enrollment for members and does not identify those members who would be classified as DDS. But I do know there's a department in Massachusetts that manages that piece. And they have a complex set of criteria that they utilize to go ahead and make those decisions. I can't break all that down for you. I'm hoping we maybe at some point in the future can have them speak at maybe a session like this. They can walk us through that. But how DentaQuest knows about it is we actually get an identifier on a file, an enrollment file that we get from MassHealth every night that tells us that the DDS members have that coverage, so we can go ahead and put them in that subgroup and make sure they're getting the benefits that they're eligible for.
Yeah, that's great. Another question was around if a provider is contacted by a parent or a caregiver of someone with an intellectual or developmental disability looking for care and they aren't able to treat them, who at MassHealth should they connect with to find a provider who's more comfortable?
Yeah, absolutely. Please reach out to myself and the DentaQuest team. We would be happy to help. We have that intervention specialist that as I had spoken about briefly. His name is Giovanni, and he works very hard to place members across the state who need special care. So please reach out to us and we'll work with you to find a dental home for them.
And I'll add that some of our upcoming webinars in the same series should touch on this topic and things to consider before you go down this road, and hopefully some other best practices that will be shared that might make that provider feel more comfortable making an attempt at treatment or following the steps they might need to do first. And another question was, are you seeing a lot of dental providers that are dropping being a provider for MassHealth? Is there a portal to find a dentist that do accept MassHealth?
I just posted in the chat to everyone a flyer that we have that you can actually scan that will take you right to the website. And I'll turn it over to Tracy, but I want people to be aware of this resource. And you'll see there's a QR code. There's also the customer service number and the website information. But we are not, thankfully, not seeing providers dropping out of MassHealth. And we want to make sure that anyone who is a MassHealth member who needs dental care receives that care in a prompt fashion. So use the information that I posted. And Tracy, I don't know if you want to jump in as well.
Yeah, absolutely. I think what we've been seeing really as a result of COVID is some reduced capacity is what we've been seeing. And so what we'd like you to do is if you have someone that you cannot find care for or they're struggling, please send them to us. Again, that intervention specialist, Giovanni, and our team will make sure that we find them a dental home. So you can use the tools, as Dr. Hayes had said, by utilizing that flyer, but also if you really feel like they need that extra bit of help, don't hesitate to reach out to us.
Yeah, and the if you haven't used the tool before, the Find a Dentist tool is very easy to use, and it's also mobile phone friendly. And you can search by the member zip code, and you can also pick your specialty that you're looking for. It's very easy, and you can break it by Health Safety Net or MassHealth. Another question: would interior zirconia primary tooth crowns instead of routine composite strip crowns be a better option added to the schedule service for IDD patients? I guess that's a Dr. Hayes one.
I believe that they're covered for the under 21 population, and we're in discussion about this. That's about what I can say at this point.
Great. Nice.
But again, I just want to point out, Matt, that using the information that Tracy provided, a provider is welcome to provide the service that they feel is best, but they must bill for the code that's currently in the schedule. So if certainly if a provider wants to provide the anterior zirconia crown, then they're certainly able to do that.
Yes. And then do you know where the identifier is on the enrollment file? This might be a Tracy question. Is it on the electronic 834 file that's transmitted from MassHealth to DentaQuest?
Yes, it is. So it's on that nightly enrollment file that we receive that tells us that they're DDS members. That's correct.
Great. And are there plans to incorporate training on treating this population in dental and dental hygiene schools to increase the number of providers who are comfortable providing care? That's a greater group question.
It is a great question. And I do know that CODA, which is the Commission on Dental Accreditation that accredits dental and I believe dental hygiene schools, there is a requirement for this training, but I'm not sure. I mean, and it varies across schools, right? There's some schools that, you know, do a much more hands-on. I think Tufts does a great job with it. They have these clinics, students, you know, go and shadow providers. They also have a general practice residency that focuses on this population. So the quick answer is yes, there's a requirement, but the variability is great. And I think that's something that those of us in the policy realm can work with educators to try to streamline the training that's provided. So when an individual graduates from school, they feel comfortable with this population.
Great. The chat has slowed down a bit. Maybe people are typing.
Just wanted to make sure I got back to Chris Farrell's question about the DD or ID disorders. In Massachusetts, individuals work with the Department of Developmental Services, known as DDS, and they become, just like with the Department of Mental Health, they become eligible for those services. So it's a separate criteria and a separate process from MassHealth. So if you're thinking about the behavior management fee, that comes from the provider. Whether or not that individual is a member of the Department of Developmental Services, they may still require extra care. And so that behavioral management fee is not just limited to those who are DDS eligible. And I just want to point out that Brittany Brown has posted in the chat box the notice of public hearings. We do have a public hearing coming up this Friday, July 16th on the proposed regulations. These are proposed, so we welcome people's input to provide guidance as to what you'd like to see changed, if anything. And you can, going to this link, you will see the notice of public hearing. You'll also have a link that will connect you to the current proposed regulations. So any written comments must be submitted by the end of the day by 5 p.m. on Friday, July 16th, and you're also welcome to join the public hearing. If you wish to speak at the public hearing, there'll be instructions on this link as to how to register in advance to speak.
Just got one additional question around, are there resources for providing oral health home care to this population?
I had one of them on my slide. If you go to, if you just, honestly, if you just Google oral health care for individuals with intellectual disabilities, you'll see that the Department of Health and Human Services provides a resource. Also, the American Dental Association. I'm not sure if the Department of Public Health does, Matt. But those are some resources that are readily available at no cost to people.
Yeah, we can research that more before the next event in the series and then share it on the next chat if needed.
Great. And please do download the flyer that was posted so that you can disseminate that to people looking for a MassHealth provider. It's an easy way to get on the portal to locate a provider. Just simply by typing in a zip code, you'll find a list of providers that are accepting MassHealth members. in the area.
And on the website, there is a member tab as well. I've talked a lot about the dentist tab, but there's a member tab as well with a lot of resources and educational materials out there. So I'm hoping folks will also direct members to the website.
And I know we didn't have this planned for today, but I think it's helpful, and people often ask about management of no-show patients. Maybe you want to mention that process that the MassHealth program has.
Sure. So on the MassHealth Provider web portal, you have the ability to report broken appointments. And so we really need you to go in there, and if a patient does not show who's a MassHealth member, you enter their information, have their ID available, their date of birth, as well as the most current phone number to reach them. That's really important because in order for us to reach them, we need the most current phone number. Once we receive that information, we go ahead and reach out, and one of our outreach coordinators has a conversation with the member to understand why they're not showing, to see what we can do to help them and assist them with keeping their appointments and make sure they understand the importance of keeping their appointments. So please utilize this tool because we do reach out to folks and have those conversations. And sometimes hearing from the program does push them, in a positive direction to keeping their appointments.
And we did get an additional question. Is there any information on the percent of individuals with IDD who need care in the operating room versus the dental office? I think there was one slide in your presentation there.
Yeah, I will say the caveat of the data that I shared is that the response rate was pretty low, but given that the majority of the providers, the majority of time, they do not need to treat individuals in the operating room. However, again, I think, these numbers could be skewed, but the vast majority of care is provided in an office setting.
And we'll just give people another minute or so in case they're adding an additional question. Okay. And can you see the additional question is, does the majority of the adult DDID population live in community group homes in Mass? Do you work closely with the group homes?
So Chris, I hope you're going to join when we have the providers, because Dr. Darren Dragg works very closely with this population and also with the group home. So he'll be much better able to give you a more accurate answer. But I will say that a large number certainly live in group homes. And I know that the Tufts Dental Facilities, again, the largest provider of care to this population, does work closely with group homes. I can't give you the percent of population, but maybe we can contact DDS and throughout this webinar series be able to provide you with more accurate information.
Great. All right. Well, before closing, I just want to take time to thank all the speakers again for their great presentations today, as well as the attendees for taking the time to listen in and ask questions. A reminder that tomorrow, Wednesday, June 14th at 12 noon Eastern Standard Time, we'll continue these sessions with a presentation from Kimberly Warsat, a health and disability coordinator with the Massachusetts Department of Public Health, on meeting the oral health needs of all citizens equitably. And finally, a reminder to complete the evaluation in order to obtain dental CE credits. The evaluation will be emailed out shortly. Thank you, everyone, and have a good afternoon.